Thank you, Michael. I'm honored to be asked to give this lecture tonight. It's going to be more of a sharing of my personal views about healthcare reform and what is going to happen in this country and what might happen if we make certain moves, what might happen if we don't. As I said, it'll be a very personal look at it, but I want to make two observations before I start. One is that obviously I have no idea about the backgrounds of you gathered here tonight in terms of healthcare policy. So I'm going to assume a kind of general knowledge and familiarity with the issues, but not any particular expertise. You'll get a chance to come at me with questions and observations at the end. The second observation I would make is that clearly I do not have any easy answers. If we had easy answers, we would probably have put them into effect, although given the political gridlock in the country right now, maybe not, even if they were obvious and easy. For most of my 35 years as medical editor at ABC, I spent my time talking about new developments in clinical medicine, new discoveries for heart disease and cancer, exercise, nutrition, etc. But in the last 5 years or so, I became increasingly aware of the fact that problems with our healthcare system or non-system were every bit as important, maybe more important, than any kind of clinical discovery we might make. And so I've spent a lot of time thinking about this, interviewing experts, gathering my thoughts in the writing of this book, and that's what I'm going to share with you tonight. I've organized my thinking on this subject and in the book in 5 major chapters, titled The Big Question, The Big Problem, The Big Fear, The Big Sermon, and The Big Prediction. So that's what you're going to get tonight in short form. So I start with the big question, which is, why does the United States spend more than twice as much per person as the average per person cost of all other industrialized countries put together, when paradoxically we are still the only developed country that doesn't provide basic health insurance for all of our citizens? That's a question that hello, Bud, how are you? My old friend, I haven't seen so many years. That's a question that ought to haunt us. Because we do spend about twice as much per person. It's the average of all other industrialized countries. And yet our outcomes are generally no different, no better, sometimes worse. And we are significantly the only industrialized country, as I've said, that doesn't provide basic health insurance. Now, if we got twice as good outcomes, I guess we could live with spending twice as much per person. But as you all know, that's simply not the case. In fact, if you look at the per capita expenditures here, you'll see that the United States is on the left, towering above the other top 4 spenders to the right. And now this year, the per person expenditure will be over $8,000 per person in this country. The average of all other industrialized countries is about $3,000. So as I said, if we got, use that, okay. Oh, I can use this too. Yeah, this will work. Yeah, excuse me. If you look at outcomes, for example, life expectancy, it's a pretty good outcome because you're either dead or not, and so you can count these numbers up. And here, even though we're the top spender by far, we're actually a little lower in life expectancy than the top 5 spenders. And of course, other countries that spend far less are considerably lower on the other end of the scale. Now, another way to look at outcomes in terms of comparing us to other countries is to look at disease outcomes. And I just arbitrarily chose to compare 5-year cancer survival rates in Canada and the U.S. We got the numbers from the American Cancer Society, the comparable numbers from the Canadian Cancer Society. And if you look through these, you'll see that the U.S. does a little better on some cancers. Here in this column, whoops, get back to that. That Canada does a little better on some. We're sort of tied for a couple, but overall, it's all in the same ballpark. In other words, we don't get twice as good results on any disease outcomes or life expectancy as we just looked at when we compare ourselves to other developed countries that spend far, far less per person than we do. So as I said, that's a question that ought to haunt us. Now, since I happen to have a slide up about comparing Canadian and U.S. cancer results, I'm going to tell you how I first became aware of the Canadian healthcare system in any in-depth way. Back in 1993, then anchor of World News, Peter Jennings, asked me to do a 4-minute report comparing the U.S. and Canadian healthcare systems. 4 minutes. And I said, Peter, it can't be done. He said, well, think about it. You'll figure something out. So what we ended up doing turned out to be very interesting and very illuminating. We called up the family practice organization in the state of New York and asked them to pick for us a 2-person family practice in that state. And then we called the comparable organization across the border in Ontario and said, pick a 2-doctor family practice for us. And once they had given us those names, we called the practices and we said, we'd like to come and talk to you about how you practice, how your office works. And we would like you to pick a young family with 2 young kids. So we went off to Springdale, New York, south of Buffalo, and a wonderful 2-physician family practice. Very thoughtful, caring, very consistent, very good family doctors. And in the course of interviewing them, I asked them how they did their billing. And they said, well, we have the equivalent of 3.5 full-time people who come in and do our billing for 2 doctors, mind you. And that's because they had 25 different insurance forms they had to deal with, and it was very complicated. Then we sat down and interviewed the family that they had picked for us with 2 young children, and it turned out to be a young couple with their youngest child 6 months old, been born 6 months before our arrival, obviously. And we looked at their records, and they didn't have health insurance because they couldn't afford it. Everything went to rent and clothing and food. But they were just making enough. He was a self-employed logger, so they didn't qualify for Medicaid. So they fell between that crack that often happens in this country. So they had no health insurance. So I said to the father, I said, so what happened when your child was born at the hospital in terms of paying? And he said, well, I sat in the business office for about an hour and a half and worked out a 5-year payment system while my wife was in labor. So now we go across the border to Canada, 2 family doctors, wonderful physicians also. And I asked them about their billing and how they did it in the office, and they couldn't even understand the question, so I had to explain to them about the doctors in New York. And they said, oh, well, we have a woman who comes in 10 hours a week and does all of our billing because it's one form for everybody, same form. Single payer, as it's called. We'll get more into that. And then the family they picked, by pure coincidence, obviously, also had a 6-month-old child. And so I interviewed the father about what happened when he went into the hospital. And again, he really couldn't even understand the question, so I explained to him what happened to the father in New York. He said, and I remember these words like they were yesterday. He said, oh, I just showed them my card and they whisked us upstairs. That was it. So I said to myself, we hear all this criticism in Canada, but there's something to be said for the system where they only have to spend 10 hours a week doing the billing and where people don't have to worry about basic things like having a child. And ever since, I've thought a lot about Canada, and I'll spend a little more time on that later on. So I come now to what I call the big problem. And there are a lot of problems I'll get into, but to me, maybe the biggest of all is what I would call the American health consumers' expectations, our unrealistic expectations. And think of yourselves as healthcare consumers when you become patients. See if you don't fit this profile. I certainly fit it myself, if I'm honest. We Americans want healthcare that's convenient, obviously, close by. We want an appointment right away when we think we've got a problem. Free parking thrown in, thank you. We want care that is compassionate, communicative, coordinated. Who wouldn't want those kind of qualities when you're sick? That's wonderful stuff. But, of course, it does require people, and people take money. Maybe most significantly, and I'll get into this more, we Americans want healthcare that is on the, quote, cutting edge. We want the latest kind of thing we've heard about on the evening news, the breakthroughs that we read about and hear about all the time. And so we more and more demand this kind of care, even though the latest may not necessarily be the best. Certainly it's usually the most expensive, but it may not be the best. But that's what we want, the newest, because we think it is the best. And then, to be honest, we want care that all of that is cheap or even better, cost-free. We don't like to pay for health care ourselves. We get very upset when we have to increase the copay from $10 to $20, right? I hear complaints about that all the time. So we have this list of expectations, but we somehow expect, because of the way we've been raised with an employer-based system in this country, that somebody else is going to pay for our bills when it comes to health care. Well, that's a formula for financial disaster. It's like we want a gourmet meal at blue plate special prices, and we figure somebody else is going to pick up the difference and pay for it somehow. So I've come to believe that this level of expectation on the part of we Americans for health care is a huge problem driving our health care costs. Now, I'm going to skip over this slide. Basically, it shows you that the majority of healthcare costs go to hospital care and physician services. As much as 2/3 of our healthcare costs are related to those two major areas. But if you look at it, there are basically 6 major drivers of healthcare costs in this country. And I start with doctors and hospitals because, as I just said, they account for most of the healthcare dollar expenditure in this country. And the basic problem with these two arenas is that we pay for doctors and hospitals on an old-fashioned model called the fee-for-service system. We basically pay for doing things. So we basically say to the two most consumptive arenas in healthcare, the more you do, whether or not it's necessary, the more you're going to make. That's the hidden message, and actually not so hidden. Doctors and hospitals have learned how to take advantage of that system quite nicely.